account because it's a use it or lose it. So every year, any monies remaining in there does not roll over. So you always want to be sure and plan wisely for your flexible spending account dollars. The cap is $2,500 annually, so you cannot put any more than $2,500 into your flexible spending. And that is healthcare law, healthcare reform law. And so that's your max that you can put in. We talked about some of the things that it covers, what you can use it for. Some of the things that it doesn't cover is it doesn't pay for your insurance premiums. It doesn't pay for things like vitamins, cosmetics, things like that. And it also now does not cover for over-the-counter medications or drugs. So Tylenols, allergy medicines, things like that you can buy off the shelf over the counter. Beginning in 2011, then that was voided. You can't use it unless you have a prescription. Is that what you was going to say, sir? Yes, unless there's a prescription written by your physician, you cannot use it. But if you do get a prescription, then you can take that to the pharmacy and you can use your flex dollars for that. Okay? You also have dependent care account that you can sign up for if you've got especially small children in daycare or after-school programs that cost you money. Again, it's a known expense, and you can take that money out of your paycheck pre-tax, and it saves you money. And so the eligibility rules for that is that the child has to be under the age of 13. You can also use it for a dependent parent that you claim on your taxes, disabled spouse, and any dependent who might be physically unable to care for themselves. You can use dependent care dollars for that. The providers for which you can use your money for is, of course, daycare centers, a licensed adult care facility, your after-school programs, even private babysitters, if they'll give you their Social Security number so that you'll have that to file your taxes. You can use it for that as well. The cap on that is $5,000 that you can put into a dependent care account. Okay, what I want to talk about now is your new online enrollment process that you will go through during this open enrollment period to enroll in your benefits. I do want to say first that if you are not making any changes, if you do not want to make any changes to your benefits, you're going to keep everything the same, except for flexible spending. I'm going to talk about that in a second. You do not have to go in the system and touch each of your benefits and make decisions. If you're in the PPO 1000 plan and that's what you want to keep, then you do not have to go into the health portion of this on the system and make any changes. Everything will roll over. Now, what's very, very important that I want everyone to understand is on your flexible spending account, if you are wanting to enroll new or you're wanting to continue what you have or make changes to what you have to go into the flexible spending account and make that election. No exceptions, because that is an IRS requirement. It has to be enrolled into every year. So nothing will roll over on your flexible spending account. So be sure if you have that today and you want to keep it, that you at least go into the system and take care of that. Otherwise, if you're not making any changes, then you don't have to do anything else. And if you're not currently today enrolled in the flexible spending and you don't want the flexible spending and you're keeping everything else the same, then you don't have to do anything online. We gave you a handout when you came in, and at the top it says KSU Benefits Enrollment. If everyone could pull that out. Probably most of you have not been in the new system. The system is called Benesolv, and the URL address is listed on the top of this page, and this is the website that you'll go into. So we put this in place in February, and so if you've been a new hire since then, you've likely already established a username and password. If you have, that will not change. It'll stay the same. But if you've not gone into the system, then the very first thing you'll need to do is log into that website and create your username and password. And you need the things that you mostly always need when you're getting any new account established online. For this one, you'll need your Social Security number, your last name, your date of birth, and then the system will give you a code. You know how they do that now? They give you this real weird looking code. You have to retype it in there, and they'll do the same thing here. So you'll do that, and then you create what you want your username and password to be. Please write that down wherever you keep all of your other passwords and usernames. I've got a sheet full of mine. Be sure you keep that, because this is a system that you will use from now on at KSU that is related to anything benefits. So later on, if you get married and you want to add a spouse, you'll go into this system to add the spouse. So this will be the system that everyone uses from this point on. But for this open enrollment, once you've created your username and password, then you will select the open enrollment button, and that gets you into the system where you'll get started. That third print screen down, there's a little green button you can see, and I know it's hard to read here, but the little green button says Get Started, and that's the button you'll select, and that gets you into all of your benefits. And each of your benefits will be listed. You'll have medical, dental, vision, everything will be listed there, and you'll see them. And if you're wanting to make any changes, there's an edit button next to each one. So if you want to add a spouse or add children, take somebody off, if you're wanting to move from the core dental plan to the buy-up dental plan, any changes whatsoever, then you'll just press the edit button next to the appropriate benefit that you're looking at, and you'll make the change you want to make. And then you'll confirm it, and you'll receive a confirmation for that specific change. And then when you're completely done, there will be a confirm button at the bottom of the page. You'll press that, and that'll give you your benefit statement that shows all your benefits you're in, what your payroll deductions are, and you can print that off and keep that for your files. And we always encourage everyone to print those and just keep it for your records, so that you've got a record of what you've got for the upcoming enrollment. Everything that you do now during the open enrollment period is effective July 1. So July 1 through June 30th. So this is the open enrollment time for those benefits. The next sheet that you had handed to you was a sheet that says Benesolv on it. And this is the system that we're using, and we wanted to give you this because it has the contact information on it. And in addition to just being an online enrollment system for Kentucky State University, it's also a customer support system where you can call the phone number, and the phone number is at the bottom of this sheet, and you can call that number for any kind of customer service issues related to any of your benefits. So if you've got a United Healthcare issue, or if you've got a Delta Dental, issue, questions on claims or eligibility, or something's not right, you can call this one number. It's a one-stop shop number, if you will, and they will serve as customer service for all your benefits. You're more than welcome to contact carriers direct. The numbers are always on the back of your ID cards. You're more than welcome to do that. But we do have this phone number that will take care of everything for you. We use it where I work, and I've had issues, and I'll call, and if needed, they've connected me, put me on a conference call with the person at Benesolv and my health insurance carrier, and we've worked through the issue, and it makes it really nice because you only have one number to call instead of all the different numbers to all the different carriers. So anything benefits related, we are urging everyone to use this phone number first before you call, for example, Human Resources, because they're just going to probably give you this number to call. And if you have, questions or issues after you call this number, then certainly call us or Human Resources. But these are good people, they're well trained, and they can help you anything that's benefits related. So we wanted to introduce you to that, and that's been effective again since February 1. We kind of put it in place before the open enrollment to work out any kinks or things, and so I think we've got that all accomplished, and it's up and running and working really, really well. Go back to this slide. The open enrollment system at the bottom, the open enrollment system will be open from May 1st to May 10th. So for this open enrollment period, you can log into the system beginning May 1st. We have our last meeting here like this on May 2nd. So we're opening the system up on May 1st, and you have 10 days, so May 1st through May 10th, to make any changes. Again, if you're not in the FSA and you're not making any changes, you don't even have to go into the system if you don't want to. If you have any questions when you're in the system enrolling, or questions or something comes up and you're not sure how to handle it in the system, call the 800 number at Benesolv and they'll walk you through and help you also. So May 1st through May 10th. There will not be anyone in Human Resources that's kind of checking reports and calling you if you haven't done anything. The assumption is if you've not done anything, then you want everything to remain the same and you don't want to be in the FSA. So there won't be any follow-up from Human Resources. So on end of day, May 10th, the system closes. So be sure you don't wait till the last minute to get all that in. Any questions on Benesolv, the new system, the enrollment process? Yes, ma'am. Yes, the question was the dependent age for children, and on your medical and your dental, it's 26. Yes, dependents are covered to age 26 on medical and dental and vision. Any other questions? Okay, remember this is your annual open enrollment, and the changes and the decisions you make now are effective July 1 for 1 year, and unless you have a qualifying event, then that's what you have, and you can't make any changes. You can't add or terminate or do anything like that unless there's a qualifying event. And some examples of qualifying events are listed. If you get married, you can add dependent, your spouse. If you have a baby, you can add newborns. Be sure any qualifying event that you have, that you make that change and you get that in the system within 30 days of the event. You've got 30 days to do that. Otherwise, you have to wait till the next open enrollment period. Okay, the last thing I want to talk about real quick, I've got a couple of slides on, is healthcare reform. I guess everyone has heard a lot in the news and in the paper and online about healthcare reform, right? We just want to say a couple of things about that to give you a couple of updates. I know everyone knows that the Patient Protection Bill or law was signed. That was back in March 23rd of 2010. The bill that came in right after that, it's called the Healthcare and Education Reconciliation Act. It was at the end of March, on March 30th of 2010. And together, those two bills formed what is called today, what is referred to as today as healthcare reform. You might also hear it referred to as ACA, or the Affordable Care Act, and also PPACA, which is that Patient Protection and Affordable Care Act. So you might hear all these terms, and they all mean the same thing. It's basically healthcare reform. And there's been a lot of things related to the bill that has been put in place since 2010. So it's gone over a phased period since 2010. But there's some significant things coming up in 2014 that will be introduced beginning at the end of 2013 that we just wanted to give you an update on so that you're aware and know what's going on. One of the main things is the individual mandate, and basically on January 1st, all individuals, unless you're on a government plan, all individuals are required to have insurance, January 1, 2014. Now, you either have that through an employer-sponsored plan, which that's what Kentucky State University is considered, an employer-sponsored plan. You have that offered to you. So everyone here is fine for insurance because you have it available to you. People can also get it through a state-based exchange, and we're going to talk about that just in a second. Kentucky is forming its own exchange, a state-based exchange, and so people will be able at the end of the year to enroll in that. Or you can have an individual plan through a carrier just on your own. Now, some folks might elect not to have coverage. It's a mandate, it's a requirement, January 1. We anticipate there'll be a lot of people that won't do it. Everyone's required to have car insurance. Does everyone have it? No. So there could be people, and there likely will be people that won't get coverage. If they don't, they'll pay a penalty. And the penalty the first year will be $95 annually, or 1% of their income if they're making a salary, so whichever is greater. And that'll be paid when they file their taxes. So I want everyone to be aware of the individual mandate. You all have coverage offered to you here, so you all will not be impacted by that. But in the fall, beginning October 1, open enrollment is supposed to happen for the state exchanges in Kentucky. So there's everyone working here in Frankfort now. Carrie Banahan, if folks know her, she's very involved in getting this up and running. And beginning at the 1st of October, that's when open enrollment is for people to go online and enroll in exchanges if they don't have coverage offered to them, or if they do have coverage offered to them that's not considered affordable, or the plans do not meet a certain actuarial value, then they're eligible to enroll in a state-based exchange and possibly get some subsidy to help offset the cost. Now, we've run your plans and your costs through an analysis, and your plans that you have today, the 3 plans that we talked about, they meet the actuarial value required by the government. And we checked on the affordability, and it's based on the employee's income. And Kentucky State also meets the affordability requirement of the government. Now, all of us sometimes think, well, my insurance isn't affordable in terms of my, how I feel personally, but in terms of the government and what they've laid out as being affordable, we meet the standards here. So you all will not be eligible for subsidies or to go into the exchange and receive subsidies. You can go into the exchange and look at the plans beginning in October, and in fact, Kentucky State will be sending you information about the exchanges at the end of the summer, and we'll help them do that because that is a requirement. All employers have to notify their employees about the exchange, whether their plans meet the value of the benefits and affordability. So you will be getting later summer, this information. So we want to just give you a heads up of what that is and why you're getting it and what it means. But I do want to stress that everything that we've looked at with the plans offered today and affordability, KSU meets all of the requirements from the government. Any questions on that? We'll be, addressing this and getting more information out to you and giving you more guidance as it becomes available to us. But just wanted to give you a high-level understanding of that right now. But any questions on that? Okay, well, that's really everything that we've got. I really appreciate your being here and your attendance and your attention. Appreciate that very, very much. Please stop by next door and see the pit vendors and pick up their packets and materials. And we'll be here afterwards if you have individual questions. Thank you.